Good evening. It's Tuesday evening live on ETV Ghana, and you're welcome to another edition of Fact Sheet, where we discuss the facts and nothing but the facts. Issues to do with comments, issues to do with views, issues to do with the expression of opinions of people don't matter when it comes to the fact sheet. It's about the content that is relevant to the nation building. It's about the content that forms and shapes the agenda when it comes to the national discourse. And tonight, we're talking about a very important matter. But on fact sheet, if it's not a fact, we don't discuss it. My name is Samuel Chen, and it gives me so much privilege to welcome you to tonight's edition of the show. This evening, we are talking about a happening, an event that shook the world. A pandemic that brought the world on its knees, that exposed world economies, that exposed government, and also showed how weak our health infrastructure programs and policies are. Tonight, we're talking about COVID-19 and the fears of the second wave of COVID-19 in Ghana. If you have been following the news, you'd realize that the world over, especially in Europe, we're being told that France, for instance, has started putting restrictions in place for 1 month. Countries like Germany, Italy, Spain, Belgium, Portugal, Netherlands, Czech Republic, Denmark, Sweden, Greece, and many more have all started putting in place measures to control the second wave of COVID-19. We all remember the impact COVID-19 had when we first started dealing with it. Tonight, we are talking about Ghana. We're talking about how we are handling the COVID-19. The fact that just a few months ago, we thought we were out of the woods, but now the numbers are indicating that the numbers are going up again. And so tonight we're focusing our attention on this particular matter. Why are the numbers going up again? Should we be concerned about it? Just yesterday, reviewing the headlines of the newspapers on the Happy Morning Show, and I always encourage you to join the Happy Morning Show every weekday between 5:30 a.m. and 9. The headlines of the Daily Graphic, very, very scary. Simply read, non-compliance with safety protocols, second wave COVID-19 likely, Ghana Health Service warns. And this drew our attention to the fact that we need to focus on COVID-19. If you check the numbers now worldwide, the global figures, these are the figures that are out there. As we speak this evening, total cases at the moment, 47 million cases. Total deaths recorded worldwide, 1.2 million. New cases being recorded, 360,608. New daily deaths, that's 6,101. Indeed, we must be concerned. But bringing it down to Africa and the sub-region, if you check the numbers, South Africa, for instance, for the past 2 weeks, has been recording some cases, about 21,291 of that. In Tunisia, they recorded 17,456. In Libya, 12,001. In Kenya, 10,954. In Ethiopia, 6,452. And then, if we come to our own Ghana, now, if you follow the Ghana Health Service own tracker, the numbers are beginning to go up. Now, from 16th of October, around the time when His Excellency the President had given his 18th address, from that time, our active cases were around 398. Now, if you check today, more cases have been recorded, 76 new cases as of November. And now, when we talk about these issues, I want to give you the figures so we work with them. Around October 12, our active cases were around 25. The daily cases we were recording was around 25. On October 13, it was around 96. On October 15th, it was around 47. October 17th, it was around 26. And then October 18th, it shot up to 111. Today, what is the number? It's 76. Should we be concerned as a nation? The political parties have started their campaign. The videos and the footages we have been seeing depict that all the people who go for these rallies have not been wearing their nose masks. No social distancing is being applied. And tonight, that's our focus. My guests are with me, and we'll interrogate the issues. For the time being, we'll turn around and be back. Welcome back to the fact sheet. As you tag along for us to discuss this issue, I encourage you to get your sheets even as we discuss the issues. Tonight, to help me with the discussion, I have Mr. Peter Kojo Kwashi. He's a senior research fellow, West African Center for Cell Biology of Infectious Pathogens, College of Basic and Applied Sciences, University of Ghana. And he's a visiting CAN fellow, Noguchi Memorial Institute of Medical Research. And I also have with me Dr. Justice Moses Aheto. He's a lecturer and researcher, Department of Biostatistics, School of Public Health, University of Ghana, also a research fellow at the University of Southampton, UK. And we'll also be joined on the line this evening by Dr. Michael Owusu. He's a clinical microbiologist and lecturer at the Department of Medical Diagnostics, Kwame Nkrumah University of Science and Technology, and we'll speak to him. If we do have the time, the Ghana Medical Association would also be joining us since they launched a campaign to, reignite the conversation about, the wearing of nose masks and then the compliance with the COVID-19 protocols. But before I turn to my guests to begin the conversation, I want us to take a look at a footage which showcases the activities of the major political parties in this country, for that matter, the NDC and the MPP, what they have been campaigning on, and the mood and the surroundings when they embark on their campaigns, and what we witness. Take a look.
What? Hello? No? I'm saying 1st November, I'm going to but the can say, I'm free or crime. If we say, so that's a suspension. So that's a suspension, no one came free one. Then it means that at a future date, you can bring you one. And he said, Yamia Duminti, and this is baby for him.
These are the two political parties seeking our mandates. There are others, but we know, obviously, it is these two that will focus our attention on. They want to lead Ghana, and yet they're not concerned about the compliance with the COVID-19 protocols. His Excellency the President has a law passed that is supposed to ensure that we comply with the COVID-19 protocols. But if you watch the footages we just showed you, non-compliance, no nose mask wearing, no social distancing, nothing. And yet, you see these politicians addressing them. That would take center stage in our conversation this evening. So I'll start the conversation with Mr. Peter Kojo Kwashi, and pick a comment from him as to what we have seen. And then we'll try to establish what we mean when we talk about a second wave of COVID-19. Because if you read the statement from the Ghana Health Service, they are warning that Ghana may go into a second phase of COVID-19. And the world all over is showing us that indeed its havoc will definitely be experienced again. Doc, good evening and welcome once again.
Good evening.
Let me start with your initial comments to the footages we just watched. These are political parties, leaders who want a mandate to rule us. These are people who are promising that they will ensure our safety when it comes to this COVID-19. And yet, the people, nobody's wearing nose masks. Sometimes they themselves and the people around them, no nose mask.
Yes. Well, unfortunately, this is something that we've seen all around the world. Countries where there's elections, I guess they look at it becomes a calculation game. Your vote versus whether they need to enforce COVID-19 protocols at the rallies or not. It's unfortunate because I think usually you expect leaders to lead by example. At the same time, well, it's an election year, so it's kind of hard to justify it. But it's been something that we've seen playing around the world in countries where they have elections, the US, for example, Tanzania, all across our sub-region too.
All right, so I will still stay with you to try to establish the warning from the Ghana Health Service. We know Europe is having its fair share,
Yes.
where they are introducing, new restrictions in terms of, what people should do and what people should not do. What does it mean when you medical professionals talk about the second wave of the disease, COVID-19? What does it mean?
So second wave normally means that you've cleared your first wave, you've done extensive testing and assured that most of your cases have disappeared, and you know where any pockets of cases would be. And whilst you maintain that high level of testing, you start to see new cases popping up. Usually, as we've seen in Europe, it may be linked to the return of popular sports. So even though the players are playing in almost empty stadiums, spectators tend to watch games in groups. So that's sort of what causes the second wave, when you have relaxing of restrictions. And then, of course, the public, once you relax the restrictions, they interpret that to mean that the risk is gone. And then you have a second wave.
Okay, all right. Now, the thinking that, many have is that, once, a lot of people have gone through the cycle, they've gotten COVID-19, I know that you can get it the second time. But we have also heard that when it comes to virology and co, there's a possibility of building an immune system that can fight off the disease. Is that not applicable when it comes to COVID-19?
It's possible. I mean, we think that it's unlikely that you would have a productive infection once you've been infected, but we don't know that for sure. And there is a school of thought out there that maybe we should just allow things to go naturally and build up herd immunity. But that is not that's not usually how you do herd immunity. Herd immunity becomes acquired by vaccination, so that most of the people who are vaccinated in the population will now become immune to them. There's a subset of the population who will still be susceptible. But that's the general definition of herd immunity.
All right, Dr. Hato, let me start with you and take your thoughts on, the footage we just saw. Are you concerned?
Yes, I am very much concerned because when it comes to public health, this is very, very, very dangerous for our survival. The reason being that we are talking about a disease that can be spread from one person to another. And one way to make sure you mitigate the spread is to avoid, gatherings of that nature. It's also to make sure that you observe the protocols, for instance, like the social distancing, the sanitizing of your hands, hand washing, that was talking about face masking and that kind of stuff. But if you look at the footage you have shown, they have nearly threw everything to the dogs. So what it means is that even if one person in that cloud pick it up, that person go back home. And those who are peacefully sitting at home can easily get infected. And when that happens, coupled with the fact that right now the government is no more doing the aggressive routine testing and screening that we started with, what it means is that many of these people remain in the population and keeping infecting others. So by the time we get to know that, hey, we are getting back to second wave, maybe nearly most of us will have get a disease. And the danger in this aspect is that even with the wave 1, you could see how Ghana struggled to manage it, to the extent that we cannot even contain 3 weeks of lockdown. We have to just let the lockdown go because the economy cannot support it. I remember vividly when the Minister of Health welcomed the revised WHO protocol on how to isolate people from the isolation centers. And the reason he gave was that our health system is being choked with COVID-19 patients. So the revised one will help them to decongest the health facilities. So this is just to let you know that the country is even struggling to fight the disease. And if you're not careful, we should face a second wave. We have already depleted all the resources. Should there be a second wave, my brother, it will be very dangerous. And that's the more reason we have to be very worried and respect the protocols.
Let me understand the second wave from the point of view of statistics in terms of numbers. Now, I am looking at, for instance, from October to November, now, October 12th. Now, if you check the daily cases recorded from October 12th, because the last address by His Excellency the President was, I think, on the 16th of October. Now, at the time His Excellency the President made that address, the numbers, active cases stood around 398. Now it's around 620 there. So about 222 has been added to the number, which was previously around 398. So now 200 more cases has been added. Now, if you look at the trend in terms of the build-up, it has an undulating nature in the sense that from October 12th, 25 cases were recorded. And then October 13th, it shot up to around 96. October 15, it came down from 96 to 47. Then on the 17th, it went down to 26. By the 18th of October, it had gone up to 111. Then on the 20th, it came down to 82. On the 29th, it was around 147. It has spiked again. Now, today, on the 2nd of November, we are being told that it has come down from 147 to 76. So if you look at the statistics, really, should we be concerned?
So
Okay. All right. Look.
Okay. So I think second wave is not applicable to Ghana.
Okay.
Because, and I don't know if you're familiar with, we just finished a project at WACPIP where we found that about 20% of people that we surveyed, that we tested, have been exposed to the virus. So we have about 20% of the population in Greater Accra region and Kaswa have been exposed. Now, why does that not reflect in the testing? It's because we are not doing mass testing. So to be able to measure a wave, you have to do mass testing. So in Ghana, and this is not to say that this is unique only to Ghana. It is something that, because of socioeconomic conditions, is happening all around Africa. So we are actually not detecting, we are still within our first wave, and what we are seeing is actually, it could be a proxy for a second wave, because it's the testing we are doing and the testing we are reporting are people coming back into the country and people who are trying to leave the country and people who are seriously sick in hospital. We are not doing community-based testing. That is the only way that you will find whether you are in a second wave or a first wave. So as much as it's concerning what's happening in Europe, it's not really applicable to us in Ghana.
All right. So if I understand you, the point you're making is that the numbers, the official numbers that the Ghana Health Service was giving us in terms of their tracker, the number did not capture a sizable number, for instance, around the Kaswa area that you are talking about in this data. Is that what you're suggesting?
Yes, it doesn't, it's not to be able to measure waves of infection, you have to do community-based testing. And as a policy, we are not doing community-based testing. So we can't extrapolate from that. It is, it's not to say that the information is not useful, because what it shows, if it's the same level of testing and you're having more positives, that shows that the percentage of positivity is going up. But we can't actually get any statistics from that because we are not doing any level of community testing.
So in that respect, I want to find out your research that you did. How were you able to identify this number of over 1 million as you reference?
So we went in, we designed it in such a way that we wanted to get a good cross-section of the community. So we went into malls, we went into marketplaces and lorry parks. And then we even did some hospitals, especially 2 institutions which were either treating COVID-19 patients or testing COVID-19 patients. These are the places that we expect to see the highest levels of exposure. And then we use an antibody test, which determines whether you have been exposed. So it's looking at the response of your body to the virus. And after we tested about 1,305 individuals across all these various public places. And what we found was people in the public spaces, especially the marketplaces, were even more exposed than those in the COVID-19 treatment facilities. So that tells you that the virus has been circulating, and last night I believe Dr. Asiedu Quinn confirmed that they are aware that the virus is circulating and that we are not actually measuring what the level of infection is.
Doc, from the statistics point of view, these numbers, what do they mean?
Okay, so before I go to that place, I think he was a bit struggling to find a correct term. Not that the second wave is not applicable to Ghana. That is not the situation. But what he's trying to say is that before you can think about second wave, you need to be doing certain things right. Okay, for instance, like the mass testing is talking about. In some countries where they are not able to do the mass testing, they do what you call a random testing. At least it gives you some fair idea as to what the prevalence will look like in your population. Okay, but Ghana, none of this is being done. Okay, so that is a more reason their study was so useful for us. If you remember, some of my earlier discussions were that, in fact, there are many of the cases out there that we are not capturing because it's only those who show the signs that we will pick them. And as we are speaking right now, those things are no more happening. Contact tracing is no more going on. It's only those who are critically ill are in the hospital. And the doctor realized that maybe I'm suspecting you of having COVID-19, so he will recommend that you go for testing. That's the first group of people who are currently being tested. The second group are those who want to travel abroad or are coming in. So apart from these two groups, no more routine testing is going on in the country. And so what that means, or what you need to take from that, is that there could be many out there who are exposed, but they are yet to be identified and tested.
But his point is that, you know, if these numbers had not been captured, then it means that we are still within our first phase.
Yes.
We have not even transitioned yet because these people have not been captured into our system in the first place.
Yeah, that's where I'm going. So that's what I'm saying, that there are a lot of people who are still out there who are not yet identified for testing. Okay, so for instance, you can go to the market runner like they were saying, there could be a lot of market women who are there. If you pick maybe 100, maybe out of every 100, you get about 60 who are actually exposed to the infection. But how do you get to know until you test them? We used to use the word that, I mean, as to the number of positives that you get, it's a function of the test being conducted. What it means is that once you don't conduct a test, you don't get any numbers.
Yes.
And that was more reason why along the line we were clapping for ourselves that we are doing well. And I made it clear that please don't clap, because once you're not testing, you don't get results. Okay, this is a challenge we are having. I was so excited about their study because when we talk about this, they thought it's just a mere statement. But the fact of the matter is that this is an infectious disease. And it's only through testing that you can tell if somebody is exposed or not exposed. So if you don't do the testing and we want us to craft for you that you're doing well, we are worried because it's about our health. So the numbers are not meaningful to some of us.
Okay.
I eat data. So I keep telling my colleagues at Ghana Health Service and even in the government that their numbers are not meaningful to me. Because if you remember, even there was a time, there are no more, the initial gold standard was that before you can discharge somebody from isolation, you need to do 2 consecutive tests to prove that indeed the person is negative. Even if any one of these is positive and the other one is negative, the person have to still be in isolation. When the WHO brought that, sorry to say, revised protocol, which many of us condemn because the study on which that was based was so poor that we cannot take it for anything. But our country quickly rushed and adopted it. Where now once you're in isolation for the number of days you show signs and symptoms of the disease plus 10 days, then you will be discharged without any further testing. Even in the same report, they made it clear that it is possible that some of these persons can still transmit the disease to others. But Ghana, we are not worried. And that was the reason why you wake up one day over several thousands of people were discharged. They said they have recovered. It took some of us to tell Ghana Health Service and the government that, look, de-isolation is not the same as recovery. De-isolation simply means that we thought your condition is okay, you can go back and continue with the management. But recovery simply means that now you have been confirmed, fully recovered from the illness, so you can go home peacefully. But when they started, they were putting all these figures together. So today, because of those things we talk about, if you go right now, they stroke recovery against discharge. So now you and I cannot even differentiate how many people actually were discharged, how many actually recovered. So in fact, there are many things that is not going on well. So I'm very happy about their study. At least we have a scientific basis to get back to the drawing board to ask ourselves, what do we need to do?
The concern now is, Dr. Kwashi, most of the cases
and sorry, before you come, sorry. What he also forgot to say is that if you look at the national figure, it's even less than 50,000. What they have done is just the Greater Accra area and then Kaswa. You understand what I mean? So if this area alone, we are talking about nearly about over 1.2 million people being exposed, which is not the entire country, just Greater Accra and then Kaswa area. What will happen if you take into account the entire nation? These are questions we ought to be asking.
Your research, did it seek to determine whether these individuals were asymptomatic or they showed symptoms? Because from all the pieces I've gathered, it tells you a lot of the cases that are being recorded now are asymptomatic cases. And so it makes it even more dangerous because the person is showing no signs but is walking about as if nothing is wrong with the individual.
Yes, so we asked, as part of it, we administer a questionnaire, and one of the questions is we asked several questions about symptoms that they had experienced in the month prior to us doing the study. And 80% of them had not had a single symptom that is recognizable as COVID-19. And just to talk about testing, 93% of them had never had a PCR test for COVID-19. That's less than, out of all the people we tested, less than 100 of them had done a PCR test.
Wow. Now, we're going for a very short breather. When we come back, we'll try and talk to a virologist and seek his views on this matter we are discussing. But we'll try and establish why we are where we are, why the numbers are popping up again, and whether it could be as a result of the actions and inactions of these politicians or the easing of certain restrictions. For instance, the trotro drivers who previously were taking three, passengers and 2 passengers, the churches that were released to go back to church and with a certain number and they're supposed to comply, certain activities and public places that previously had been locked down. Now, these places are now being allowed to operate. Where really would the wind or the storm blow from in terms of this second wave which we are talking about? We're going for a breather. We'll be back. With our sheets this evening on Fact Sheet live on ETV Ghana. You can follow the conversation on Facebook, Twitter, and Instagram. Facebook, our handle is ATV Ghana. On Twitter, our handle is ATV_Ghana, and you can follow the conversation. We're talking about the second wave that has hit the world and Ghana, whether we are in danger. The Ghana Health Service is talking about the fact that there's a likelihood of a second wave of COVID-19 hitting Ghana. But interestingly, just this evening whilst I was preparing for the show this evening, I chanced across another piece that is also coming from the same Ghana Health Service. I'd like to share that with our listeners. Now, The first wave is coming from, the warning is coming from the Ghana Health Service. Then we have another one, which is also coming from the Ghana Health Service, which states, I'm trying to allow for the, the page to open so that we can share that with our viewers who are watching us in their homes, what the content says. It says that COVID-19, we are not on the verge of second wave. Ghana Health Service, the same Ghana Health Service. The first one, it was Dr. Da Costa Abuaji, who is the Director of Health Promotion Division of the Ghana Health Service and leader of the risk communication for COVID-19. Now, if you read this one also, now, it says that Dr. Patrick Kumar-Abuaji is the one who is speaking. The Ghana Health Service has downplayed suggestions of a looming second wave of COVID-19 infections in the country. According to the Director of Ghana Health Service, Dr. Patrick Kumar-Abuaji, available data does not support the suggestion. And that the current numbers show a slow but steady rise in active cases over the month of October, raising concerns that Ghana may have to soon deal with the second wave of COVID-19 as is happening in other countries if nothing is done to arrest the situation. But Dr. Kumar-Abuaji does not believe a second wave of the virus is looming. So the same, Ghana Health Service, one holds the view that we may hit, a second wave, and then another holds the view that, look, we are not even close to it, considering the numbers that we are getting. But I ask myself, when around March thereabout, we started recording our cases, there were just about 2 cases. Just about 2 cases. But today, if we are able to pick around 147 and 111, should that not be a cause for concern, Dr. Kwashi?
It should be a cause of concern, especially considering how little we are testing. I think last time I looked on the dashboard, positivity rate is around 10%. And so if you extrapolate that, if you even ignore our study and you say that that positivity rate can be extrapolated over the whole country or over Greater Accra region, you're still talking about a lot of people.
Yeah.
All right, let me go to the phone lines and speak to Dr. Owusu and seek his views on this matter. He's a virologist and would like to seek his opinion on this matter, because at the end of the day, it comes back to their doorsteps as well when it comes to, trying to, sample and identify whether there are new strains or not. It all falls within their domain. And so Dr. Owusu joins us on the show. Doc, good evening. It's good to have you on the show tonight.
Yeah, good evening.
I trust you're doing well today, sir.
Yeah, I'm doing very, very well.
All right, Doc, so we've been talking about COVID-19 and the fact that the world is now bracing for the second wave, and whether Ghana should also be bracing itself for a second wave. From where you sit, should we?
Yeah, good evening to your viewers and listeners. So, the issue of second wave, as you have mentioned, that countries in Europe are currently experiencing, and the bigger question is whether Ghana and other African countries are likely to experience this or not. As I said, I also told some other colleagues that it's difficult to tell. You really can't, you cannot predict how the terrain in Africa will look like, because the peculiarity of the African context in terms of the epidemiology of populations you are dealing with seem to be much deviated from what is happening across Europe. And the pattern of infection in terms of the epidemic curve and how things happen in Europe does not seem to happen like what we see in many parts of Africa. So you can see countries experiencing some things, second wave, we go to third waves, but then if you want to place it within the African context, it's not that straightforward. You have to look out for a number of factors. Just to throw a bit light on this second wave, some of the indicators you want to look out for if you want to tell a country if it's a second wave or not is: one, the number of active case counts compared to what happened previously, the number of new daily infections, and then the reproductive number. If you look at the data available so far in some European countries, somewhere in Belgium, Germany, and Spain, most of them have their first cases somewhere in February. And then around April, they had the highest number of new infections. So if you say you reach your peak point, it means that within the epidemic curve, on a particular single day, you've recorded the highest number of new infections, after which you begin to record low numbers. So Belgium had about 2,000 cases per day on 10th of April. Germany had about 6,000 cases. Spain had about 9,000 cases. Russia had about 12,000 cases. So after that, they began to record low numbers. I mean, the numbers were reducing. The hospitals were becoming more decongested because people were not getting sick anymore. The place were becoming empty. And then somewhere in October, for instance, Belgium, which previously had about 2,000 as the highest number of infections on 10th of April, now began to record an increase in about 12,000 new cases. So if you compare what they have now in terms of the highest number of new infections compared to what they had previously, it's almost about 4 times higher than that. If you look at the case of Spain, which had about 9,000 new infections on a particular day, 24th of March, as of 14th of October, they have about 15,000 new cases. So the trend is that you see a peak point at a certain month, and then you begin to record new infections that will now go much higher than what you recorded previously. If you look at this within the context of Africa, and in Africa, countries like Egypt, Algeria, Nigeria, South Africa were the main drivers of the coronavirus spreading in our continent, within the African continent. Most of them, as we speak now, the number of new infections that they recorded, which was somewhere in the month of July, they have not yet recorded new daily infections higher than what they used to record. The pattern in Kenya is what is a bit worrying. Kenya, which seems to be getting closer to what we call a second wave, because they had their first case on 14th of March, and then somewhere on the 25th of July, they had about 916 new cases per day. It was the highest they got so far. After that, they began to record reduction in the daily new infections. And then somewhere on the 21st of October, they now had about 1,068 new infections. As at 30th of October, they now have over 1,395. And the hospitals are now recording an increase in the number of people reporting with mild cases and severe cases. So they are beginning to feel the pressure. So Kenya is one of the countries that seem to be satisfying the conditions that mimic what people now want to call a second wave. So
all right.
For the case in Ghana, you really cannot tell. But if you have countries like Kenya, which have gone gradually showing some of these features, it is possible that if people don't take the precaution measures very seriously, then of course you may have this also happen. I can't tell when, but then what we will say is that we just have to be very careful and ensure that we follow through the protocols.
Are the conditions not ripe for this second wave we are talking about, considering that at the public places, at our markets and the trotro, people are not wearing their nose masks, the social distancing is not being observed, several public places, all these things are not being observed. Are the conditions not, conducive for resuscitation of the disease?
Well, if the conditions that are taken here, in terms of people's behavior, I mean, for some time now, you are right that people don't seem to care much. They throw caution to the wind. Those who are supposed to put on masks are not putting on a mask. And people are behaving strangely because they feel that it is over. But then the thing is that the data that we have seen so far does not seem to suggest that we are entering into second wave. I mean, for me, in KCCR, for instance, I have, since this epidemic started from March, I have been observing the data closely on what we call an incident new cases per every 100 PCR plates that we test. So from somewhere in March and April, we had about 10% of every 100 cases that come to our facility. And then somewhere in June, July, it rose to about 60 to about 80 cases. In August, we had the highest number of, sometimes about 100% of all cases you test become positive. And then somewhere after August, we began to record reduction in these new cases. As we speak now, if you test every 100 PCR plates, you only have about 5 out of every 100 becoming positive, which does not seem to suggest that you are having new people becoming infected. Although we don't do mass testing to cover large populations, because of logistics constraints. most of the target populations are people who present with signs and symptoms of COVID. So if you take 100 people presenting with signs and symptoms of COVID, and you used to record 90 out of 100 of them becoming positive, and now within this phase, you are recording 5 out of 100 for the same target population, it tells you that indeed people are not becoming infected like it used to happen. But then, as I said, this virus, like we know, many other starts within the family, where we understand that you could have immunity that could last from about 4 weeks to about 52 weeks, I mean 4 to 6 months. So if you look at the period, look at Belgium, look at Germany, Spain, it took about 4 months from the first case to the peak point. And now it's taking close to about 4 to 6 months from the first peak point to their, what we call their second wave now, where they are recording very higher new cases compared to what they had before. So if you want to predict for Ghana, then it is possible somewhere 3, 4, or 6 months, if people are not careful, that they may begin to experience what others experience. But it's not easy to tell because of our peculiar situations we have in our country.
Give me a little bit of education in terms of the parameters, because we are dealing with figures now. Now, if you talk about the peaking and then its lowest point, at what point do you classify, some range as the lowest point? Because should the numbers have dropped to, let's say, 0, or should it have dropped to, let's say, 100, that you classify as, the lowest point in terms of the peak point that was reached earlier? I'm trying to establish, the issue of the wave.
Yeah, so Ghana recorded its very first cases on the 12th of March 2020. And earlier on, because of PCR delays in reporting, we were not getting new number of infections. If you remember, most of the cases that were coming were backlog cases. We had a point where we had backlog of about 1,000, 2,000. But somewhere in June, July, where we began to issue results within 48 hours, we had things quite normal. And even as of now, we are able to deliver results within 24 hours. So if you look at the data, somewhere on the 1st of August was when we had about 1,200 new cases. It was the single highest number of new infections that were recorded at that point. So after August, most of the new cases will be reporting. We're now reducing from 1,002, we went to about 900, 800, going down to about 600, 400. The last time before the president's speech, he mentioned that we had about 25 new cases on the average, new infections on the average. Now I think it's even a little higher than that. So I'm looking at a point where if we are to still even target populations of those who present with COVID signs and symptoms with what we are testing now, with cases here having about 1,200 capacity and which testing about 4,000 with all about 16 facilities across the country, and we hit a point of about more than 1,000 new infections on a particular day, then we indeed know that we are heading towards what they are also seeing.
All right,
and
Doc.
Once again, not just new infections, but then the health facilities must also begin to report an overwhelming number of people coming with signs and symptoms of the disease and who are positive. So these are things you want to put into consideration before you can confidently say that your country is in that point where you have to be very careful.
Doc, well, thank you for joining us this evening on Fact Sheet. And that's Dr. Michael Owusu joining us on the show this evening. He's a virologist, KCCR, sharing his thoughts with us on the show. We have just about 6 minutes to end the show. And so let me come back to the studio for us to pick up some wrap-up comments. Now, hypothetically, if we are within the second wave, as we are saying, is Ghana ready, Dr. Kwashi? Hypothetically, in terms of the issues about PPEs, in terms of the issues about medical facilities and all, would we be able to sustain a second wave, hypothetically?
Hypothetically, Ghana would not be able to sustain a wave where we start to see large numbers of people with symptoms. If we had a wave where we start to have large numbers of symptomatic cases, then we would have a problem. If it's a wave where it's large numbers of asymptomatics who don't get detected, then we wouldn't see them, so we'll be fine.
All right. Dr. Hato, Now, we'll end the conversation with that of, what factors have brought us where we are in terms of the non-compliance, which obviously would lead us to where we don't want to go to, which is the second phase of, the COVID-19. What are the factors? What do you see has brought us where we are?
Okay, so in fact, I think even the way that Ghana Health Service and the government communicates information around the COVID-19 to the population has to be managed properly. Yes, because if you create an impression that, oh, yeah, we are doing so well, so we are getting out of the woods, when actually we are not doing so well, people begin to relax on what they're supposed to do. If you remember initially when this thing started, people were so aggressive in respecting the protocols. Everywhere you go, everybody's in mask, washing everything, social distancing. But now everything is thrown away. I don't bring all of them, but because sometimes the way the communication goes to the people, that is one. That secondly, too, we find ourselves on a continent where we know for sure that our resources are so limited. And there are certain things that we will not be able to do. But at least the basic thing that we can do, we need to be doing them. For instance, like I was talking about, I don't know if he knows. As we're talking right now, we don't know the prevalence of COVID-19 in Ghana. We don't have that data. But every now and then they will come and tell us that all that they are doing is based on facts and figures when you don't have the data. So this is the biggest worry we have. And that is why I believe that some of the interventions they are putting in place is not working, because they don't have the right information to act on. So to me, these are two critical things I want to talk about. Data quality is one thing. Then the way we communicate the risk to the people is another thing. We don't communicate the risk to make it look like, oh, we are getting better. You can let them know that, yeah, we are on top of the issues, but you need to do A, B, C, D before we can get to what we want to get to. But when you leave it hanging, sometimes even you hear politicians coming to insult the other side of the party, that, oh, they are saying that we are not doing well, don't mind them, we are on top of them. The moment you begin to speak like that, then we are losing interest.
Doc, from your point of view, I mean, why are we where we are? I mean, the non-compliance issues, why are we where we are?
I mean, we're where we are because of non-compliance. And I think it's also because, like you said, it's an issue of the public feels that the virus is gone. So if the virus is gone, why should I have to respect the social distancing? If we are having mass gatherings, why do I have to wear my nose mask? It's really, we need to have some focused, targeted education, which is not just saying wear your nose mask, but educating on why it's important, and also why it's not just about protecting yourself, but it's about protecting the vulnerable people you have at home. We know that the vast majority of people who get infected, especially in Ghana, will show no symptoms, will have no effect. But those vulnerable people you have at home, that's the people that we need to protect.
5 minutes to the top of the hour 8. This is Fact Sheet live on ETV Ghana. If it's not a fact, we don't discuss it. My name is Samuel Ishen. I'd like to thank you for being a part of tonight's deliberations. It's all been about the pandemic, COVID-19, the fear that there might be a second wave in Ghana, especially with what's pertaining across the world. Next week, Golden Tuesday, we'll be here to discuss another matter. But I'd like to thank my guests who made time to join me tonight on the show. I'd like to thank Dr. Moses Aheto for making time to join us tonight on the show. He's a lecturer and researcher at the Department of Biostatistics, University of Ghana, and Dr. Peter Kojo Kwashi, Senior Research Fellow, West African Center for Cell Biology of Infectious Pathogens, joining us today on the show. We'd like to thank Dr. Michael Uzo as well, KCCI Kumasi, for also making time to join us. We're expecting to speak to some other individuals, but unfortunately, time has not been our friend. And so, God willing, next week, Tuesday, 8 p.m. sharp, on Fact Sheet, we'll be here. As always, it's always about the facts and your sheet of paper. I thank you.